Hi everybody, today we're talking all about expectations of your hearing aids.
Hey guys, I'm Dr. Michael Squires.
And I'm Dr. Carly Squires.
And this is Dr. Squires Squared.
This is a channel where we have candid and casual conversations about anything and everything audiology.
And if you're not sure what audiology is, make sure to hit the like button, subscribe to our channel, hit the notifications bell so you can keep up with all of our great content, and we'll tell you all about it.
All right, everybody, welcome to part one of this three-part series that we are doing all about hearing aid expectations. We are going to start by talking about what hearing aids cannot do, and then we're going to talk about what they will do, and then we're going to kind of mesh that all together and just talk about expectations in general and making sure our attitude and our mind are right to start on this journey. So again, today we're going to start by talking about what can we expect that hearing aids are not going to do for you?
You know, a good place to start with what a hearing aid is not going to do is to talk about one of the most difficult situations that we as people with hearing loss find ourselves in, and that is background noise.
Yes.
I can't tell you how many times patients have come in and say, oh, I just need a little tweaking, can you turn the background noise off? And my answer to that is, if I can figure out how to do that, then I'd be a bazillionaire and you probably wouldn't see me sitting here.
Well, it's important to remember too that if you have normal hearing, my hearing is normal, I hear background noise. I hear an air conditioner running right now, in fact. So you can expect that your hearing aids are going to pick that up as well, because remember, the goal is that the hearing aids, although they can't make hearing normal, we're trying to mimic that of a normal hearing system. So yes, you are going to hear background noise and little things in the background. We can adjust that and make that more manageable to your brain, but we can't eliminate it. Just like we can't eliminate background noise for a normal hearing person.
Right, and a quick point about that is the whole point of background noise suppression and things like that from each of the manufacturers is to not replace the brain's ability to get rid of background noise or manage background noise. It's actually to create what we call a signal to noise ratio.
Right.
The hearing aids are a tool to create a separation between those two things, speech and background noise. It's up to the brain to actually differentiate between the two, which leads me to another topic of oral rehabilitation, which can help the people who get new hearing aids to do that. We'll talk about that in an episode on another day.
Right. But yeah, that's so true though. It's just all about making sure that your brain is able to separate what you want versus what you don't want. And when your hearing is normal, your brain is able to do that. But when it goes a long time without input, without sensory input, we have to reteach your brain with hearing aids how to again do that. So it's really important to just keep that as an expectation. You're going to hear background noise and those sounds that you maybe haven't been hearing for a while. And yeah, at first they're going to be a little loud, a little more kind of right in the front of your focus. But over time, the goal is that is still going to be there, just not as noticeable, I guess.
Right, yeah, which is a kind of a beautiful transition into another thing that hearing aids can't do, which is restore normal hearing or make you hear like somebody with normal hearing. Mm-hmm. The brain is wired a certain way when somebody has normal hearing. Mm-hmm. And just as Carly mentioned here a second ago, we have to rework or reestablish a new normal for the brain. And when we change the way that sounds go in the ears and the brain interprets those sounds, then we can kind of work towards that goal, knowing that it's not going to be a light switch, automatically everything's perfect.
Right, it's not going to be perfect. There will still be situations that are difficult. I've had people come in and say, well, so-and-so still can't hear me, even with their hearing aids when I'm behind them or I'm in another room or we're really far apart. And that is an expectation that needs to be there, that the hearing aids aren't going to work that magic and make things perfect. I mean, I can't hear you from another room, and I do have normal hearing. So
and we're audiologists, and we know this, and we still talk to each other from that.
Right, those habits.
That situation.
Yeah, those habits are hard to break. But just keeping in mind that the hearing aids are not miracle workers to make your hearing completely normal again. They are in fact an aid to help you in difficult situations, not make them perfect.
That's a really important thing to note, is that hearing aids are a tool. Mm-hmm. You know, it's like a wheelchair or a cast or a boot or anything like that. These are tools to help us achieve a goal. The hearing aids are with us for the long term, but we can adjust how we use those tools or how we use hearing aids in order to influence how well we do with them in certain situations. For example, if we don't put our hearing aids in or don't put them in correctly, naturally they're not going to work the way that they were intended to work. We work with our patients one-on-one a lot in order to make sure that they have a good idea of how the hearing aids are supposed to fit and how they're supposed to feel. That's a lot of times where feedback and things like that come from.
And it just takes a lot of practice. I mean, we practice, like Michael said, in the office. We make sure we have a nice amount of time set aside at that initial fitting to make sure that you're comfortable putting the hearing aids in, taking them out. But it also takes some effort at home to practice so that you can be confident that they're in correctly, so that then the hearing aids can do what they're supposed to do for you.
Yeah, I joke with my patients that when we're little kids, we can't seem to find our mouth with a fork, but when we're adults, we can't seem to find our ears with our own hands.
That's true.
And it takes a lot of work. It's like learning how to put contacts in. It takes work. And if you're willing to put that work in, you will no doubt be more successful on the other end of that.
All right, so let's talk a little bit about the technical side of this. So hearing healthcare and audiology is in fact paramedical and in a healthcare field, but because we use hearing aids as a tool to help you hear better, there is a little techie component there. So we need to kind of touch on that issue that there's going to be repairs that need to happen sometimes.
Yeah, definitely. Hearing aids, just like many other consumer electronics, oftentimes are running on a battery or a rechargeable battery, or they have capabilities like things like Bluetooth compatibility with the phones, which has admittedly become a bit difficult in practice because we don't know everything there is to know about every phone that's out there, and there are a bunch of them. But what I will say is have some expectations that things are not going to work perfectly all the time. The hearing aids are designed to help you hear and to give you access to speech, and they do a really good job of that. They're also Bluetooth compatible, and they do a good job of that. But sometimes there's going to be a breakdown in communication between a phone and the hearing aids, just like there would be with any other Bluetooth device. Right.
I mean, we've all had issues with Bluetooth connection at some point or another, whether it be your car, your Alexa at home. I mean, any of that stuff can kind of get a little finicky. Hearing aids are no different.
Nope.
We've seen some issues with some Bluetooth, but when it works really well. It's a pretty slick feature.
Absolutely. The next thing we talk about is the need for repairs or just general maintenance.
Right.
Just like anything else, hearing aids require some general maintenance, and occasionally things break down. Carly, you had mentioned earlier about the atmosphere that these things live in.
Yeah, I mean, think about it. When you have hearing aids, that means you're wearing them, if you're following our recommendations, during all waking hours, meaning when you get up and start your day, you've got those guys in your ears. With hair, you're going to have hair product, you're going to have skin from your ears, you're going to have wax, you're going to have moisture. Everybody sweats. So think about that all day, every day. That can break down. There's going to be issues. In that case, there are warranties on the hearing aids. You've got professionals here to help. But just keep that in mind, that there's probably going to be at some point in your hearing aid lifetime a repair or two or more that need to happen because of the use, the wear and tear that you're putting on the hearing aids.
Yeah, and that kind of begs the second point that we can't do much for you as the patient if we don't know about the issues. So your providers are on standby. We're ready to help you with anything that needs to be helped. But if we don't know about it, then we can't do anything about it.
Yeah, I've had people come in and say, I'm sorry to bother you with this issue. Not at all. That is our job. We're here to help. We are not here to be mind readers. Remember that. So definitely call us if you're having an issue, and we'll do our best to try to help you along with that. And most of the time, I tell my patients, if we can't 100% fix the issue, we can at least help you to be in a better place with that.
Right. All right, everybody, we're going to wrap up this episode about what we can expect hearing aids not to do, or not necessarily to do at 100%. It's important to keep all of these things in mind, but more importantly, I think, is to keep in mind the things that hearing aids can do. And that's what we're going to cover in our next episode.
Yeah. So if you liked what you heard today, give us a like, share it. If you have ideas for future topics, send us an email, info@hearwv.com, or give us a call, 428-2403.
Until next time.
Thanks.
See ya.